So the community link workers, we're a service where we are referred to by the GP. People can come in and it's where they've got issues and struggles which are affecting their health that are not medical problems.
If it's a social issue such as financial, housing, social isolation, lack of exercise, anything like that, if they're carers, they get referred to us and we try and help them.
So it's certainly not unusual that we have a patient in who comes with multiple issues going on, and obviously we deal with the medical issues, and then often there's many other layers to it which are probably contributing to their medical problems and their well-being.
Some of the patients are happy just to talk. Sometimes you can talk to them and they've never actually spoke to anybody else. Sometimes we signpost them to the likes of caring organisations, connecting carers. Sometimes we refer them to Citizens Advice for money issues. I've seen myself turning up at somebody's front gate with a food parcel, with a clothes parcel. I've seen me filling in forms for attendance allowance. One of the biggest ones, I filled in a form for somebody to get new central heating and a new boiler, etc., which has clearly enhanced their quality of life. So in the first instance, we give them a phone, we explain about confidentiality, and we explain that we work with social issues to the patient. It's then very person-centred, so it's up to them. Some people are happy with telephone calls and getting the information via email. Some people come to our various offices, clinics, wherever we're based. Some people we meet in the community, so we meet at cafes. Some people are more comfortable with that. We then have long conversations, and quite often the one issue they were referred for is not, there's more to it than that, and we try and address one at a time all the issues.
It's very important that the community link worker is integrated into the practice to ensure good communication, and if there are any areas of concern that are raised, then the community link workers can speak to us, or if we've got concerns then we can speak to them.
The GPs are an expert on their patients, so it's really good to get further information, and also equally what the patient discloses to us. Sometimes the GPs should know that, so it's equally important to pass that on to them.
Well, I actually went to my GP for a medical problem, and then as an aside I took the opportunity to just mention some problems that I was having. I suppose you would describe them as kind of mental health problems. After the first meeting with the community link worker, I actually felt really positive. I came away from it thinking that this was somebody that could support me, that had understood me. I was encouraged to try and take a sort of mindfulness approach to things. So to be aware of my thoughts and my feelings, to try to be in the moment, appreciate the moment a bit more. Also, I think I got the understanding that it was okay to feel the way I did sometimes.
To be in that position where you know you need help but you don't know how, that can be very terrifying, and you just don't want people to get worse. And so I feel that this service is something that we can provide for people just to help them take that step when they recognise there's a problem and they just need a bit of support.
I went with an open mind. I had no idea what the community link worker would offer me. In fact, I was apprehensive because it felt as if I was possibly admitting some sort of mental health problem. I'd never done that before or opened up to anybody in that way before, but I found it immensely helpful in many layers, in many ways, and I would say absolutely go with it and go with an open mind and see what they have to offer you.